and my dear friends, good afternoon to everyone. I am Muneera from Family 5th year. Today's topic is on kill the cancer. The cancer, the word which sends the shivers down the spines. The word which carries the fear, uncertainty and pain. Let's take a pause for a moment and ask, what is cancer? At its core, cancer is a biological paradox. The cells which used to protect us, suddenly they become rebellious. They refuse to obey the normal rules of the growth. They multiply without control. They become invaders across the world. Imagine a computer with corrupted software. A small mistake or an error in the coding will lead to a malfunction of the entire system. That's the cancer, where a minor genetic error which lead to the changing scripts of our life. But cancer is just not a medical condition. It is social, economical, emotional challenge. It doesn't only affect the patient's life, but it also affects families. It drains the resources. It tests the patience and strength of everyone. Here lies the truth that cancer is not invincible. Our first weapon is prevention. Study shows that more than 1/3 of the cancers are preventable. How? We can kill the cancer before it grows. How? We can kill it without letting it to grow. How? With tobacco cessation, reducing the consumption of alcohol, maintaining a diet, exercising regularly. We as the future healthcare professionals, we must aware the people about that prevention is not just a piece of advice, it is a medicine. Detection is our shield. Earlier the cancer is caught, higher the survival rate. So we must detect the cancer as soon as the symptoms are appearing. We can go for breast self-examination, cervical cancer screening, colonoscopy, and awareness of the warning signs. Because my friends, cancers whisper before it grows. We must learn to listen. Innovation is our sword. How? Medical science has entered into an exciting era, like targeted therapy, monoclonal therapy, immunotherapy, CAR-T therapy, and precise therapy for the cancer. These are just not the big words. These are the weapons which are used against the cancer. We as the family graduates, we must aware the people about the prevention, and we must support the awareness camps of cancer. We as a family graduate, we stand out with the intersection of drug development, rational use of the drug, and patient counseling. But we must not consider that we are only drug dispenser, because we are the partners in this fight. Compassion is the hidden cure. How? Because the physicians will treat the disease, but a kind word and a smile, encouraging and reassuring smile is as much as important as chemotherapy. So let's not forget that medicine is both science and art. So my dear friends, cancer is just not a challenge for the oncologist. It is a